Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. So I'm going to try something a little different on this little segment, which is we're going to be going over Jackie Kennedy. It's interesting, I wanted to go over because we just did Marilyn Monroe, and I wanted to do a little bit of comparison to Jackie Kennedy because they're often mentioned in the same paragraph or same sentence. I wanted to just take a minute to look at the natural beauty of Jackie Kennedy and maybe some little surprises near the end. But I think looking at her pictures as well, looking at her when she was younger, teenager, early 20s, very beautiful, striking features, a very natural beauty. I know there's a lot in the news about her skincare regimens and what she did with her skin, and I think she did do a great job with that. And I personally don't think she did any plastic surgery. But I thought it might be fun to do two different images of her of what she could have done if she did plastic surgery. Make herself just a little bit, teeny bit more beautiful. And if I'm looking at her in her, late 20s, early 30s, the one thing that stands out to me is I think she's striking, by the way, and beautiful, but if she had done maybe a slight refinement on her nose or slight rhinoplasty, it's a little bit thick and wide, I think it would have really brought out her eyes and her features a little bit more. Again, this is something that's not as popular back then, but nowadays I just wonder if people would have done things like that. I also noticed that her brows are a little heavy, have a little bit of a more angry expression. If she'd done at that time maybe a little bit of Botox, or if she could have, or a little bit of threading in that area, again, I think it would have given her a little bit more of a pleasant, rested expression. It's just some subtle things. I'll put some pictures up of what that actually would look like on her face, and it's kind of interesting, and it's subtle, but again, I like that. I like people that look like just a prettier, more beautiful version of themselves and not somebody totally different. And then if we look at her later in life when she got a little bit older, what could she have done for rejuvenation? Similarly, some of those changes we see when she's younger, the rhinoplasty would have lasted a long time, so she probably wouldn't have tweaked that. But again, it's one of those things that can make you look younger if you take a bigger nose and make it smaller. I also think that again, the things we didn't have back then, what I've done to the face would have been probably a little bit of a mini facelift, in her later 40s or 50s, and along with that some microneedling, some skin rejuvenation, and I think at that point possibly a little bit of a brow lift, because again that brow got a little bit heavy, and I think that would have opened her up and just made her look really rested and younger and beautiful. So I think those are some of the things that she could have done. Probably weren't as available back then, and not that she wanted to do it. I'm just saying those are things I find interesting, that what would she have looked like if she had done those surgeries.